Hello, I'm Marilyn Miranda. I'm the Chancellor here at the University of Illinois Chicago, and we're so very pleased to welcome all of you here. The mission of UIC is to provide the broadest access to the highest levels of educational research and clinical care. We pride ourselves on the fact that half of our students are first-gen, 56% are Pell Grant recipients, and we serve the most vulnerable populations across Chicagoland and, in fact, across the state. For that reason, our Medicaid patients, the people that we serve through the Medicaid program, are so deeply important to us. They are in our mission statement. We are so delighted that we have the opportunity to host this event. We are so proud that we live in a state that is willing to have the kind of leadership that we have here in our state of Illinois. With that, it gives me incredible pride to introduce the governor of our state, who I admire deeply and who is a champion for health care and equitable outcomes for all Illinoisans and, in fact, for all individuals across the country. Governor Pritzker.
Thank you, Chancellor. Well, good morning, everyone. I really am proud to be here with Illinois' doctors and patients, members of our Congressional delegation, and partners in the General Assembly. And together, we're sending a clear message: hands off Medicaid. From day one, the Trump-Vance administration has put working Illinoisans' health care on the chopping block. Donald Trump said he wouldn't cut Medicaid. Said it several times. But within hours of taking office, Trump was signing executive orders to weaken it. And then this week, House Republicans voted to advance a budget that requires $880 billion in funding cuts, much of which has to come from the Medicaid program in order to pay for tax cuts for the wealthiest Americans. And Donald Trump endorsed the budget plan. Speaker Mike Johnson said about Medicaid recipients on CNN, "We're going to send them back to work." Well, this ignores the fact that most Medicaid recipients do work. Nearly 1 in 4 Illinoisans are enrolled in Medicaid. These are working moms and dads. They're people with disabilities. They're seniors. These are our friends and our neighbors. 3.4 million Illinoisans are covered by Medicaid. Who are they? Medicaid covers nearly half of our state's children. Half. It's the largest insurer for people who live in nursing homes. Farmers and rural agriculture workers and their families will lose their health care. But it's also a broader economic issue. Illinois hospitals and our healthcare systems and supports provide jobs for 445,000 people, and they anchor many rural communities. Hospitals will close. People will lose their jobs. Illinois is doing all that we can to bolster access to health care. We've expanded access and made enrollment easier in Medicaid. We've invested in health care infrastructure. We've erased hundreds of millions of dollars in medical debt. And we're taking on predatory practices in the insurance and pharmaceutical industries. And if Medicaid is cut, no state in the country has the money to backfill the billions of dollars in funding. It will be gone. And the consequences will be devastating. People will be stripped of life-saving care, people will die, and blood will be on the hands of the Trump-Vance administration and the Republicans in Congress. Today, I'm asking Illinoisans to make their voices heard, demand that Trump and Vance and Republicans in Washington prioritize your health care over tax cuts for the wealthy. Stand up, speak out, show up. Dial 202-224-3121 and ask for your congressperson and make sure they know what your views are on preserving health care for Illinoisans and for all Americans. With that, I'm very proud to hand over this podium to a fighter for Illinois' working families, someone who cares deeply about health care for all Americans, and that's my partner in governance, Lieutenant Governor Juliana Stratton.
Good morning, everyone, and thank you, Governor, for your fearless commitment to our people. In the interest of time, I will echo the Governor's appreciation for all the advocates, elected officials, and providers who came together today. Your voices have real power. Thank you for using them. No amount of warning or mental readiness can prepare you for the news that our federal government has turned their backs on all but the wealthiest people in America. The first people who will feel the damage of what Republicans in Congress did on Tuesday night are the most vulnerable among us. As a mom who knows what it's like to have a sick child and wanting nothing more than to end their misery and help them heal, I am furious that Donald Trump is working overtime to strip away health care from over 1 million children in Illinois. As a daughter who cared for my elderly mother who suffered from Alzheimer's, holding her hand until she took her very last breath, it is unconscionable that Republicans would push a plan to punish our elders by cutting off the care that could extend their lives. And as a Black woman and the mother of 4 Black daughters who live with the horrific reality that Black women in Illinois are 3 times more likely to die from pregnancy-related complications, it is entirely unacceptable that we would put these women at an even greater risk of dying because the Trump White House wants to give tax breaks to the wealthiest of the wealthy. In Illinois alone, we expect these cuts to strip away health care from over 3 million Illinoisans, over 1 million being children. And without access to Medicaid in urban, suburban, and rural communities alike, people will die. Hospitals will close. Healthcare deserts will expand. The health equity gap will widen, and our economy will suffer. But no matter what, the state of Illinois and our administration will not turn our backs on you, and we will not sit idly by and watch as Donald Trump, J.D. Vance, and the Republicans too afraid to stand up to them strip you of your life-saving health care. The leaders standing with us today are here to make you, the people of Illinois, make sure you know that you are not alone. We see you, we stand with you, and we will fight for you. With that, it's my honor to pass it over to Illinois Department of Health Care and Family Services Director Lizzie Whitehorn. Thank you.
$3.3 million Illinoisans, 72 million Americans. That is how many people rely on Medicaid for health care coverage. But under any of the proposed cuts, Republicans and the Trump administration would strip away health care coverage for hundreds of thousands of Illinois residents who cannot access affordable coverage alternatives. This could be a senior whose income is $15,600, a pregnant mom whose household income is less than $68,000 per year, a family of 4 that makes less than $102,000 per year. Since its inception 6 decades ago, Medicaid has become an integral part of the American healthcare landscape. Medicaid is the largest health insurance payer in Illinois. Last fiscal year, the Illinois Medicaid program invested over $20 billion to support hospitals, doctors, nursing homes, and pharmacies, with more than half that funding coming from the federal government. Illinois hospitals and health systems together generate nearly $118 billion for the state each year. When Congress last attempted to eliminate the ACA Medicaid expansion, Illinois stood to lose 55,000 to 60,000 jobs statewide and $7.5 billion in economic activity. Massive Medicaid cuts will ripple throughout the system to healthcare providers of all kinds, safety net hospitals, federally qualified health centers, and behavioral health service providers, to name a few. They would be forced to confront difficult decisions about cutting staff and services. Medicaid cuts will also have negative impacts you might not realize. Medicaid is the 3rd largest funding stream for K-12 public schools in the state, currently providing over $250 million in federal dollars to support schools annually. This would directly impact students across the state. If the Republicans succeed in passing any of their proposals, the state simply could not pick up the difference in federal funding. Instead, Trump and the Republicans would effectively be forcing devastating cuts to longstanding benefits and eligibility standards, shrinking the Medicaid program as we know it. There are so many devastating aspects to these plans and so many different statistics we could all provide. We all have a play to roll in telling the story here. We in government can't do this critical work alone, and I want to thank some of our partners who are here today on the front lines with us to protect coverage for Illinois medical customers, especially Stephanie Altman at the Shriver Center, Carrie Chapman from Chicago, from Legal Counsel for Health Justice, and Nia Kelly from the Chicago Coalition for the Homeless. Yes. Any of the proposed cuts will create widespread turmoil, from the individual customers who lose coverage to the healthcare system and economy more broadly. They not only threaten to undo critical work achieved here in Illinois over the last 6 years to expand access to high-quality healthcare, but they will severely limit even the most basic healthcare for millions of Americans and send the uninsured rate soaring. We cannot let this happen. With that, I am happy to turn it over to Dr. Radosto, the Chief Medical Officer at U of I.
Thank you, Director Whitehorn. Hello, everyone. My name is John Radosta. I'm a primary care doctor, and I'm the Chief Medical Officer here at UI Health. UI Health is proud to be the only public academic medical center in Chicago. Every day in our hospital, our physicians, our nurses, and our staff work tirelessly to provide the highest quality of care to our patients. As a mission-driven and patient-centered organization, we strive to ensure cost-effectiveness in our care as well. As Chancellor Miranda mentioned, a large portion of our patients here depend on Medicaid to fund their care. As a public hospital, the University of Illinois Hospital and Clinics also relies on Medicaid, just like our patients do. Medicaid is essential to keeping our doors open. The doors at our facility, just up the street, and the doors where we're standing right now at Miles Square Federally Qualified Health Center do not remain open without Medicaid. This is the case at countless other hospitals across Illinois and the country as well. Medicaid is the single largest payer for mental health services in the United States. Medicaid helps patients stay healthy, healthy enough to hold a job, healthy enough to access critical maternal health care, and age with dignity in our community. Medicaid funding is critical for our patients. One of my patients, a woman in her early 50s, was diagnosed with breast cancer. Only through her Medicaid coverage was she screened for breast cancer, diagnosed at an early stage with breast cancer, and treated with life-saving surgery and chemotherapy to treat her breast cancer. Medicaid allowed her to beat breast cancer. Another of my patients, a man in his 40s with high blood pressure. Screening for high blood pressure and treating chronic conditions helps prevent strokes, helps prevent heart attacks, helps prevent kidney failure. Having Medicaid allows for prevention. It allows for treatment of chronic conditions. This improves the health of our community. Access to high-quality health care and medication is critically important to all people of Illinois, truly for all Americans, to help manage chronic diseases, to help provide preventative care, to keep our communities healthy. Thank you to Medicaid. Thank you to UI Health. We've made a meaningful progress towards improving access to care. Governor Pritzker, we appreciate all your efforts and the efforts of all others and our elected officials to protect Medicaid. Thank you. I'd like to introduce Senator Dick Durbin.
He's the richest man in the world, and he's quite a dancer. You probably saw the television presentation when he danced on stage with a chainsaw in his hands, laughing about all of the cuts that he's going to make to Medicaid and critical programs for American families. I guess there were people in the audience laughing with him, but I'll tell you, Sophia of Palatine was not laughing with him. She wrote me a letter and said her 4-year-old son has gone through 8 surgical procedures already. And she said, "What am I going to do, Senator, if there's no Medicaid to pay for the next one?" She wasn't laughing at all, and we shouldn't be either. Because in addition to the families and individuals who are going to face real hardships by closing down aspects of Medicaid, we're going to see one aspect of our medical care and our economy which is truly, truly threatened. Dr. Radosta talked about UIC Hospital. 59% of the inpatient revenue at UIC Hospital is Medicaid. La Rabida, 94%. What's going to happen when we take a 15% cut in Medicaid to these hospitals in Chicago? And what's going to happen to the hospitals in the downstate communities that I represent? The senator or the congressmen gathered here today all voted against this plan from this administration in terms of the budget. But there were a lot of Republicans in the delegation representing those downstate hospitals who voted for that plan. How will they be able to explain the closing of a critical care hospital in their communities downstate? I don't think there's an easy answer. And if you get down to the bottom line of why Trump is doing this, it's to generate a tax break for the wealthiest people in this country, just like he did in his first term. History tells us he incurred more national debt in 4 years than any president in the history of the United States, and he's setting out to do it all over again. Why? He wants to give a tax break that is pointing at the richest people in the United States. 60% of that tax break will go to people who make more than $400,000 a year. For God's sake, the people who need a helping hand don't make anywhere near $400,000 a year. So we've got to stand up and speak up, and that's why this press conference is so important. I'm glad to be here with the governor, the lieutenant governor, and all my colleagues in Congress. What we have to do is to come back with a mighty voice, because our mighty voice has to drown out the sound of a chainsaw that is really inspiring the people in Washington. We've got to make that difference, and I know that we will. The man I'm about to introduce has dedicated his life in Congress to this area of our state and to the people we're talking about today. It's my honor to introduce Congressman Danny Kenyatta Davis.
Well, thank you very much, and I am delighted to be here. Chancellor Miranda, to all of the medical personnel who are present, all of the interested parties, my colleagues in the House, to the best senator in the United States of America, the leading governor in this country, and all of you. I must take a moment of personal privilege and tell you that where we are standing started in a 2-story building, house on Washington Boulevard. I also must tell you that I used to work here, and I get my health care here, right here, every week. It's one of the best in the country. And when you start messing around with Medicaid, you're talking about wrecking the health care delivery system, not only here, but all over America. There's no way we can stand for that and let it happen. I was pleased to vote against the draconian bill last week in the House of Representatives with all of my colleagues. Every single one of us voted against it because we know the impact of it. The other thing I know is that if all that you do is cut, all that you get is blood, blood, blood. And the blood of the American people will be on the hands of those who held the knife. So yes, we will fight back till the end of time to retain what we have developed. Nothing will take us back. We will not allow these cuts to Medicaid and other areas to stand. Now the next person, and I don't even know who it is, but it's on the sheet, so all I gotta do is look. The chair of the Health Brain Trust for the Congressional Black Caucus, Representative Robin Kelly.
Thank you to my colleague. I always tease him, he brags, we do everything in his district. But anyway, good morning, and thank you to Miles Square Health Center for hosting us today, and to Governor Pritzker for inviting me to speak. Democrats are absolutely unified to protect Medicaid. As you know, this week, House Republicans jammed through, and I mean jammed, their budget plan to cut at least $880 billion from Medicaid. And I'm so proud to say that every Democrat voted no. We even had a Democrat that just had a baby that flew in. We had a Democrat that just had an operation that came from the hospital, had an IV thing on the plane, because we know how important this is. But it's truly shameful that in the House, not one single Republican sided with the American people. Millions of their constituents, just like our constituents, are dependent on Medicaid for health care. So they're now on the record for actively voting against Medicaid. They did not vote with their constituents in mind, but instead, as you've heard, they voted for a $4.5 trillion tax cut for their wealthy friends. But the truth is that cuts to Medicaid will hurt everyone. It doesn't matter if you're a Democrat, Republican, Independent, or someone who didn't vote, or where you live. In my district alone, 17,000 people covered by the Affordable Care Act see their premiums go up over $1,000 per year. Over 300,000 people in my district on Medicaid will lose health care. Almost 190,000 people won't be able to put food on the table without SNAP. And also, I've done a lot of work around maternal mortality and morbidity, and I'm very concerned about the bill that came through that I sponsored that extended the postpartum period from 60 days to a year. 40% of women who have babies are on Medicaid, and I'm so concerned that more women will die. It's already a problem we shouldn't have. And I'm very proud that Illinois was the first state to expand the postpartum period, and now I'm shocked we're up to 49 states. But we need 3 brave Republicans to stop the madness. And unfortunately, we're not going to find them in Illinois. That doesn't mean we should give them a break. We should call Boss, Miller, and LaHood constantly every day to tell them to do their jobs. But as the governor said, we need to stand up. We need to speak out. This is not the time to stand on the sidelines. We are fighting with one hand behind our back because they're in charge of everything. But as my friend John Lewis, who we're getting ready to celebrate in early March, said, this is the time to get into good trouble. Thank you. I'm acting like you. I'm kidding. Now, it is my absolute pleasure to introduce my chair, my ranking member in Energy and Commerce, the warrior, Jan Schakowsky.
Okay. Thank you so much, Governor. I'm really happy to be with all of you today. I am going to give you 1 minute. I remember the rule. You said, let's try and get people to do it for 1 minute. I want to tell you about 2 women who I met at a senior building. That's where they live, in a very nice building. And people are anxious to be able to get all the health care that they need and have in the past. 2 women who contemplated suicide because they were so afraid that they were not going to be able to get the care that they need. They thought, if I'm not going to be able to get the medications, that was the thing they mostly needed, that they were not going to be able to live. Now, there was a whole group of people who talked them out of it, but I think you get a sense of how people are so afraid right now. I want to tell you that Elon Musk gets $90,000 every single day. Why? Because he gets money from the the things that they get money, that he gets money for. And seniors get $65 a day. That covers some of the things that they need. It's absolutely disgusting. We have to stop that. We have to make sure that no one is afraid in the United States of America that they are not going to get their health care. Thank you to all the providers, all the people who are working so hard. I love you so much. Thank you. And next is, let's see, who is at the next one? Can someone tell me? Who's it? And now, my dear colleague, Bill Foster.
Well, hello, everyone. For those of you who don't know me, I'm Congressman Bill Foster. I'm a scientist, a businessman, and I'm proud to represent the distant suburbs of Chicago in the 11th Congressional District. You know, I want to assure you that my colleagues and I are doing everything in our power to stop these harmful cuts to Medicaid. Trump, Elon, and the Republicans in Congress are gutting programs in Medicaid, they say, so that Americans will have more fiscal responsibility going forward, fiscal responsibility. But in reality, the reason that they want to cut these essential health care benefits for hardworking Americans is to give trillions of tax cuts to their billionaire donors. And that's exactly what they laid out in the budget that they passed last week. In my district alone, over 130,000 people on Medicaid are at risk of losing their health care under the Republican budget, and this includes nearly 70,000 children and 13,000 seniors over 65. Nursing homes would have to shut down. People with disabilities and their families would lose access to the programs that they rely on to live independent lives. Now, Republicans like to pretend that Medicaid is only a program for undeserving urban areas. You know, you read it all the time in their social media that they do back home. But the truth is that rural areas are even more dependent on Medicaid. And it will also aggravate, these cuts to Medicaid, the number one fiscal problem for Illinois, which is that every year the average citizen of Illinois loses $1,300. That's over $17 billion in a typical year for the state of Illinois, because we pay a lot more in federal taxes than we get back in federal spending. And if these cuts cause us to lose the Medicaid expansion, that will get far, far worse. So I just want to let you know that I'm going to continue to fight in Congress to preserve Medicaid and to work in lockstep with our state officials to see that Trump, Elon, and the Republicans in Congress are stopped. Thank you. And now, Raja Krishnamurthy.
Good morning. I'm honored to be here. I want to say a big thank you to all the healthcare professionals here. Can you give them a big round of applause? My wife's an anesthesiologist. The joke is that we both put people to sleep. So I apologize in advance. 2 points, very briefly. One, I received this letter from someone in my area, and I just want to read it to you. It says, "Dear Congressman Raja, please help me save Medicaid. Medicaid helps me to live and work. Without Medicaid, I cannot be healthy." And this is from a gentleman named Jonathan Campuno. He's an adult with severe autism. He lives in our area. He's an avid pianist as well as swimmer, but Medicaid provides the funding for his daily therapy so he can survive. This man is about to see his Medicaid and his services cut. And for what? For tax breaks for billionaires, oligarchs, and broligarchs. That is wrong. Donald Trump claims that he loves and cherishes Medicaid. Instead, what he is planning to do to Medicaid in the form of almost $1 trillion in cuts is a perverse form of DEI. Dire, extreme, and irresponsible cuts to our social safety net that will devastate Americans. I am proud to stand with my governor, my senator, my fellow members of Congress in opposing all of these cuts, but we need everyone to stand up, speak up, and do everything they can in the next months to come to oppose what will be the worst cuts to our social safety net in American history. Thank you. And now I'd like to introduce Congressman Caston. Believe it or not, there's a meme coin for Congressman Caston. He can talk about it more later.
Thank you. So when Mike Johnson suddenly found himself being surprisingly elevated into the role of the speaker, he told a reporter, "If you want to know what I think, just read the Bible." So what I want to ask you all is, which part of the Bible says that you should persecute the meek so that you can give tax breaks to the merciless? Because that is exactly what these Medicaid cuts are doing. You're hearing from all the people who are here, right? This hospital depends on Medicaid funding. Doesn't matter whether you're Medicaid eligible. If you go to this hospital, that means these cuts mean you don't get health care anymore. Maybe you live in a community that's got community health centers that are providing preventative care for folks to make sure that they stay healthy. Those shut down, well, all of a sudden those people get sicker, then they go to the emergency room, and I don't care how rich you are. I don't even care if you're Speaker Johnson. You now have to wait in line at the emergency room while you're bleeding out because there's not the resources that are there to take care of that. Maybe you're a senior citizen who's finding yourself in a nursing home. Well, Medicare doesn't cover the cost of the nursing home. Medicaid does. What are you going to do to live with dignity? Maybe you're someone who has a child or a brother, a sister, or a cousin with special needs who gets the kind of dignity to have a decent life from someplace like Misericordia or Little City or UCP Seguin. Those places shut down. Are you prepared to provide the resources and change your life around to manage that? We're here today because everybody who is up here knows that when you see an injustice in the world, you stand up to it. Knows that when you see a bully on the playground picking on the little kid, you say, "What you do to the least of these, you do unto me." And to my colleagues who are unable to do that, the nicest thing I can say about you all is you are unfit for public service. So keep up the fight. And I want to now hand it over to my friend, my colleague, my fellow class of 2018er, Congressman Chuy Garcia.
Good morning to all, and I want to say thank you for your leadership, Governor Pritzker, to my congressional colleagues and state legislators who are here, and of course the health care providers who are here. You know, Donald Trump and his yes men like to talk a lot about family values, but the truth is that the Medicaid cuts are a direct attack on working families, like families in my district, but especially against children. We know their playbook: gut health care, blame immigrants, and rig the tax system to give the freeloading billionaires colossal breaks. That's what this is all about. These cuts will hurt families, devastate entire neighborhoods in immigrant communities like the ones I represent. Medicaid keeps clinics open, hospitals running, and kids healthy. Kids like my 4 grandkids who rely on Medicaid for their health insurance. If you take away health care and Medicaid, you create a public health crisis. So today, we vow not to let families in my district and across Illinois have to scramble for medical care. And 2, we will not let them take us backward. Muy buenos días. Voy a ser breve. Para Trump y los republicanos les encanta hablar de valores familiares. El hecho es de que esta propuesta de recortar fondos es un ataque a nuestras comunidades y en particular a nuestros niños y niñas. Conocemos el manual: desmantelar el sistema médico, culpar a los inmigrantes, manipular el sistema de impuestos para favorecer a los multibillonarios. Estos recortes dañarán a las familias y devastarán a vecindarios enteros. Las comunidades inmigrantes como la que yo represento dependen de estos programas para la salud de niños, de otras personas, y el impacto sería devastador. Por eso no permitiremos que las familias en mi distrito y en todo Illinois queden sin seguro médico, y no permitiremos que nos regresemos para atrás. Ahora quiero presentar, and I'd like to present my colleague, Congresswoman Lauren Underwood, who is a medical provider because she is one of our nurses in Congress.
Good morning. Good morning. Thank you so much. As you heard, I'm Lauren Underwood, and I'm a nurse. And strengthening and expanding access to health care that keeps our families healthy and helps them thrive is my life's work. I'm here to tell you that Donald Trump and House Republicans' attacks on health care are un-American and unacceptable. They are attacks on the very values that make our Illinois community so strong, the values that make us who we are as Americans. More people are going to get sick because of Donald Trump's actions. Families who are already struggling to make ends meet will be devastated by these cuts to Medicaid. Our maternal health crisis, which is already taking so many of our moms' lives, will get worse. Now, as you may know, I represent suburban and rural communities outside of Chicago. And we have had 2 of our rural hospitals close in the last 2 years. 2. These closures have been catastrophic for my constituents' ability to access the health care that they need. It's part of a rural health care crisis that's spreading nationwide. It's devastating families and leaving millions of people with no way to access care. Hear me when I say this. Slashing Medicaid to pay for tax cuts for billionaires will pour gasoline on that fire. But friends, none of this is inevitable. Time and again, during Donald Trump's first term, we fought him and we won. Together, my colleagues up here and I made sure that he knew if you come for Illinois families, you will lose every time. Again and again and again, we taught him that lesson. And we are prepared and we are ready to do it again. But we need your help. And I have just 4 words for anyone watching at home who is in despair, wondering what they can do in this moment. We only need 3. We only need 3 House Republicans to stand with us to protect Social Security, to protect Medicaid, to save the Department of Education. We only need 3 to stop Elon Musk. We have 3 representatives who are Republicans supporting this mess, who claim to represent Illinois families. We have 3 Republicans that are currently representing districts that Kamala Harris won in November. We know that there's about to be 3 vacancies in the House of Representatives. There are also more than 3 toss-up seats, friends. I'm not here to tell you which 3 to reach out to, but I am here to say we have to channel our advocacy right now in a way that will protect our values and our health care and these vital services and the programs that our families rely on. So I'm going to just leave you with this message. We just need 3. Thank you again for joining us, and I am so happy to turn it over to my colleague and my friend, Congressman Jonathan Jackson.
Thank you so much, Congresswoman Underwood, and to the distinguished persons on this panel, to the governor, lieutenant governor, to the dean of our delegation, Congressman Davis, and also to our senior senator that fights so hard. We appreciate your work. I just want to make one thing very clear. If you know the name ABE Health Plan, if you know Health Choice, if you know All Kids, people are confused about who is on Medicaid. All of those plans are affected. It starts today on Medicaid. Then Medicare cannot survive without a healthy Medicare and a Medicaid. So we're all inextricably bound to this same thing. And we remember they first came after the book bans, then they went after the rights on women's bodies, then they pushed it on to DEI, and now they're on to the health care. This is a wrecking ball. And how ironic, let this moment not be lost, that the world's most powerful man, the President of the United States of America, Donald Trump, has an unholy matrimony with the wealthiest man on planet Earth, and now they're the cruelest men on planet Earth. Now they have denied food aid from going to the poorest people on earth, and at the same time, they're offering up Visa for $5 million that you can get a gold card. It's all about money, money, money. Those that come into public service, I'm so glad to be affiliated with all of my colleagues up here, put the people first. They should take their hands off our data, hands off of our Social Security, and hands off of our Medicaid. It is my honor and my privilege to introduce the Honorable Dalia Ramirez. Congresswoman.
I'm a tad bit shorter than Congressman Jackson here, even with heels. Buenos dias. It is so good to be home. Qué lindo poder estar en casa después de 4 días in Washington en el caos de allá. It's so good to be home after 4 days, Governor, in the chaos of Republican chaos that we saw on that House floor and every committee hearing. You don't need me to tell you the impact. You know it. You live it. You see it as you serve the thousands and thousands of Illinoisans that are impacted by the reckless decisions that my colleagues are making every single day. But as Congressman Jackson just mentioned, people may not understand that. We can't say we care about children and be okay with the fact that in my own district, 94,806 children would be impacted by these Medicaid cuts. We can't say that we care about our seniors when we know that so many of our seniors depend on Medicaid to stay alive. 1 in 4 people in my district depend on these services. And they need it for colonoscopies and for their mammograms, for maternal care, for pediatric care. And folks, this is a moment where we must ask ourselves, are we doing everything in our power to fight back? The people that you see here, the delegation, the governor, the lieutenant governor, the doctors, the organizations, the community health centers, the organizations here, we have to stick together in this moment to fight back like hell to protect Illinoisans from the reckless attacks that can result in deaths for so many people. There are no words to be able to actually put into context what you heard my colleagues talk about. Tax benefits for the wealthiest Americans who have everything they need and more over the working families who depend on Medicaid for basic health care. What they are doing is evil. And we have the obligation to remain defiant in our position that everyone, independent of citizenship status, zip code, or age, have a right to a dignified, healthy life. This is the moment, folks, to remain unified with our state, with our county, with our cities, and with this Illinois delegation to say, not on our watch, Donald Trump, and billionaire who now wants to also take over air traffic. Not on our watch. This is a moment for us to fight this undeterred fight for a working people's budget. And let me say to you, it is the honor of my life to know that I'm in the fight with all of them and all of you. So with that, I want to introduce to you my colleague, my state senator, who's in that fight in the General Assembly, the one, the only, Senator Omar Aquino.
So I need to apologize for a second. I'm walking a little stiff this morning because of the fact that I was actually at my neighborhood safety net hospital just about 12 hours ago. I drove in from Springfield. I couldn't physically get out of my car because I had threw out my back. But because of the safety net right in my community, I was able to go and get treated and at least barely get up and speak here today. But I want to thank you all to those that provide the services day in and day out, be it if it's in Miles Square here at UI Health, anywhere in the medical district here, or anywhere throughout the state of Illinois, that you go in every single day trying to save lives, be it if it's through a pandemic or on a day like today. You all are healthcare heroes. And what healthcare heroes don't need is for Donald Trump and Republican Congress folks to take away and strip away the healthcare coverage of our folks that are most in need. It is evil. It's also a dumb plan because our safety nets and all our hospitals and our FQACs, especially I would say in the district that I represent, Humboldt Park Health, St. Mary's and St. Elizabeth Community First. They are on the northwest side of the city of Chicago. They are economic engines in our community. Not only do they provide great quality health care right in our community, they also provide jobs to folks that live right in our community. They also provide contracts to other businesses that give things to that hospital to protect folks that are in need and in care. What kind of plan strips away health care to someone and thinks that that family is going to be stable, that person is going to be able to go to work any better, that person can get educated any better? This is a terrible economic plan. Terrible. Most people need health care. And unfortunately, for working class folks, a lot of folks that depend on Medicaid, they are about to see so many cuts, it's going to impact the entire system. Entire system. Even if you have Medicaid or not, this is going to impact you. If you go to one of our, to UI Health, to Northwestern, or other places and you say, hey, I have, a private insurance. Well, when you go to the emergency room, you're going to have to take a ticket. Because if they're closing other safety nets throughout the entire state and critical care access as well, where are you going to go? This impacts every single person. This is going to have a devastating impact on our economy and much more a devastating impact on our families. We all deserve better. This is the richest country in the world. Healthcare is certainly a right. It shouldn't be stripped away by the richest man in the world just because he wants to dance on stage with a little chainsaw. We all deserve better, and we should fight and make sure that people know and that Republican Congress folks and the man in the White House knows that we are going to demand better. With that, I want to introduce Representative Mueller, who's in the fight with me in the state of Illinois, making sure that we are protecting Medicaid. Please.
Good morning. It's an honor to be here with you today. I want to thank our congressional delegation, our Senator, Governor Pritzker, Lieutenant Governor Juliana Stratton, and all of the advocates and healthcare providers with us this morning. I'm State Representative Anna Mueller. I represent the 43rd District here in Illinois. I also serve as the chair of the House Human Services Appropriations Committee and chair of the Medicaid Working Group. As in these roles, I see firsthand the life-changing impact of Medicaid on families for millions of people here in our state. As we start our budget-making process, the bill that passed last week that slashes $800 billion in federal funding throws all of our programs that we have supported here and built on over the past several decades into disarray. As has been mentioned, Medicaid is more than just a safety net. It is a lifeline and a promise that poor children, people with disabilities, the elderly, and those who need it receive the essential health care that has been provided to them since 1965. Medicaid has been a program in place for several decades. With the Trump administration and Republicans in Congress proposing these drastic cuts, it would devastate Illinois families and their health care providers. In Illinois, Medicaid is the #1 source of funding for behavioral health and long-term care. Currently, 2 out of every 3 seniors in nursing homes receive care because of Medicaid. And we know that half of all babies born in Illinois are delivered safely thanks to Medicaid. Cutting this funding threatens our most vulnerable mothers, infants, and seniors. In my district alone, 30,000 residents rely on Medicaid funding. And this funding pays for more than just direct health care benefits. It also helps to pay for people who have developmental disabilities live lives of dignity and hope. Last night, I had a very long conversation with a gentleman who lives in my community, Jonathan Shively. His son, Ben, who just turned 30 this past month, is a resident in Lamb's Farm in Libertyville. He waited for 12 years to get he waited for 12 years on a list to be able to receive services and residence at Lamb's Farm. Ben has severe developmental disabilities. His dad, Jonathan, called me concerned and very worried about what these cuts, what this bill that passed in Congress will mean for his family. He and his wife are aging. They will not be able to take care of Ben as they get older. Medicaid is a lifeline for Ben and those who live in Lamb's Farm. I didn't have an answer for Jonathan. I told him that we were fighting as hard as we can here in the state to make sure that his program continues to be supported. But as has been mentioned, we don't have the resources to cover the healthcare costs if Congress and the Trump administration renege on their promises to our families. So 30,000 people in my district are affected. And we know that in communities across our state, hundreds of thousands, if not millions, are affected, which thanks to HFS, we have the data to understand how many people in our communities rely on Medicaid. So in doing a little bit of research on my community, I found the statistics for the 3 congresspeople who voted against Illinois families and voted for this bill last week. Mike Bost, who represents the 12th district, he has 197,000 residents in his district alone that rely on Medicaid. Mary Miller's 15th district has 181,000 residents on Medicaid. And Darren LaHood, his district, 140,000 residents access health care through Medicaid. It's unconscionable that they voted against these residents, these families, seniors, children, parents, voted against their health care and best interest to support Trump and his allies. We know that the Affordable Care Act is a strong federal-state partnership, and if we see cuts to the Affordable Care Act, states could end up losing between $1 and $2.1 trillion between 2025 and 2034. That would require impossible choices for states, cutting enrollment or having to pay the difference, which we cannot afford. So we can't allow Trump and his allies to dismantle the support systems that keep our families, communities, and states strong. This truly is not just about balancing budgets. It's about balancing our values. It's about compassion over cruelty, dignity over despair, and community over chaos. And with that, I'm very honored to, again, introduce and bring up Governor Pritzker, who's been such a champion for us here in Illinois on all things healthcare. I'm proud to stand with him in this fight. So, Governor Pritzker.
Happy to take any questions from members of the media. Yes, hi, Olivia.
I wanted to ask how this discussion today moves the ball forward, just because as driven as the delegation is, Democrats are the minority in Congress right now. Who's the audience for us tonight?
The public. The public needs to speak up, speak out, show up at their congressional town hall meetings. They need to pick up the phone and call Congress. They need to call their friends in other states. I mean, that is who this is aimed at. Yeah, we know that the Democrats are in the minority in the House of Representatives, in the Senate right now, but every person out there that brings their whole heart to this and stands up and fights. And you've seen, I mean, these are the Avengers. This is a team of people who are in Congress. Yeah, they're trying to convince their colleagues, the Republicans who voted against the interests of the people of Illinois, to vote the other way, because those people who voted against the interests of Illinois also voted against their interests in their state. And they're going to have to explain it. And some of you have seen the videos of town hall meetings where people in Republican districts, Republicans, have shown up to tell their congressperson, hell no. You're getting it wrong. And so we hope that people will hear us, speak up, speak out, and get the job done. Yes, hi. Sure.
WGN has reported for months on how IDOT misled the public about delays in the Kennedy Reversible Lanes construction project. And it was on time, even as contractors were
sending memos that for months it was behind schedule. Then a major feeder ramp was reclosed because the automatic gates don't work. Has anyone been held accountable for these problems? You regret reopening the express lanes for the DMC this summer, now knowing that the cost of drivers on an extra month.
Well, you make it out like there was some purposeful misleading of people when the reality is these are complex projects. And when you've got multiple subcontractors, one subcontractor that isn't able to complete a part of a project can delay the entire thing. You can't let the cars run if you don't have, for example, the guardrails up, or you don't have we run, as maybe you know, some fiber optic lines underneath these roadways. And if you don't have all of that complete, you can't let people drive on the roadways. So, I don't know what to say except, yeah, there were delays. This is unfortunate. It happens. It's not something any of us like to see, and we work really hard to get it on time. And by the way, most of the projects that we have across the state have been coming in on time. But yes, this was one. It's a complex project. Anybody that's driven those roadways knows how complex they are. Yeah. Yep. Yes, sir. Yes, it is.
What would the impact be on your recent budget if those federal funds in the worst case scenario were taken away?
Well, to be clear, there's no chance that the state of Illinois can make up for the dollars that we would lose if Medicaid is impacted in the ways that we believe that it will be. Because you're talking about, if you just talked about the Medicaid expansion, which they're talking about seemingly much more than that. But if you just talk about that piece, right, that's about $7.5 billion that the state of Illinois would have to come up with in order to extend that program and pay for it ourselves. There is not $7.5 billion in the state of Illinois that we have to make up for that program. What would we have to do? I mean, we have contingency programs that we've thought up and put on paper that we want to put in place if, God forbid, this happens. But the reality is it's going to involve, encouraging free care clinics, making sure that hospitals stay open as best we can, because there are going to be layoffs across the state of Illinois. And, Senator Durbin said earlier that, he's from Springfield. All across central Illinois, where he's from, there will be closures. I mean, literally, these hospitals cannot survive without, they have population, sometimes 60, 70, 80% of the population that they serve are Medicaid recipients, just like the safety net hospitals here in the city of Chicago. So it will be devastating. There is not enough that the state can do to make up for the damage that Elon Musk, maybe I should say President Musk, and President Trump will do to the people of Illinois. Yeah. Hi.
Everyone today presented a very robust case for why Medicaid is needed, who it's serving, but on a national level, there is an intense information war going on. And conservatives won it during the election, and arguably they're winning it now. And that is that it's not all of these things that everyone says. The government is wasteful and bloated. How do you, as a Democrat, how do all of you as Democrats break through and really get to people? Because there are a lot of Americans who believe, well, of course there's waste and fraud in the government. Of course they should cut things. How do you break through with your messaging?
First of all, Natasha, welcome home. Second, look, let's be clear. The messaging isn't something that we're making up and selling out there. It's not a campaign. There is anger out there. And anybody who's looked at the polling data can see there's been an enormous shift. A big shift from the beginning of this administration only 39 days ago. A big shift in people, demanding that Donald Trump carry out what he said he would do during his campaign, and people understanding that he's not doing that and that we've got to stop him. That is a huge shift. I can tell you I've seen polling data where, the question of whether they want politicians to work with President Trump to get things done, or whether they want you to stand up and resist against what President Trump is trying to do. And that number has shifted by almost 20 points. People want you to resist. So it's the people out there that's shifting. Frankly, I don't think it's our messaging that's having the effect. It's the real world impacts on people's lives all across America. And I can tell you in the state of Illinois, because I hear it every day, Republicans are calling in, their phone lines. You can call in and tell your story about what's happened. People are calling in, veterans, people are, law enforcement officers whose lives are being affected. Some people losing their jobs, of course, in the federal government, but many people are losing their jobs because when you cut child care, the parent can't go to work. Now you've lost your job. Talk about the cost of things going up. When you don't have an income, things are pretty darn expensive. Not to mention what in about, I think Tuesday, we're about to see 25% tariffs on everything from lettuce to tomatoes to beer to automobiles. 25% tariffs from our neighbors. These are our allies, Canada and Mexico. This is, if you don't think this problem is going to get worse for President Trump, you're wrong.
Governor, we heard the DuPage County Sheriff announce his plans to run for governor himself as a Republican. Wondering if you have any thoughts on that and if you've made the decision yourself on running for re-election.
Good luck. Everybody has the option of running for public office. I understand he announced yesterday on his Facebook page. So I don't really have anything to say more about that. And I have not made up my mind about whether I would run for re-election.
We'll do one more.
Thanks, everyone. Oh, Olivia, one last one. Look, she got her hand up just in time. Yeah. It does. I believe that it does. I mean, it is important for you to be heard. And so I encourage everybody. But yes, I've been on local television, national television, podcasts, and online telling people, pick up the phone and call. Because, by the way, there are Republicans that live everywhere, even in Democratic districts, and it's important for their voices to be heard. I believe that this is an important time in the history of the United States. Do you remember the Tea Party efforts in 2010, where people were showing up at their town hall meetings and screaming and yelling because they wanted change, right? And it was because they were angry. Things were, this was right after or during really the Great Recession. And people felt, a lot of angst and a lot of concern about their futures. That tended to be Republicans that were showing up. What you see now is people on both sides of the aisle showing up. And I think that's why we're talking about this. It's why every day each one of us has to get the message out about what's really happening. Because, Donald Trump wants you to focus on Greenland and whether we're going to buy Greenland. And he wants you to focus on whether we're going to go invade and take over Panama Canal. He wants you to focus on anything other than what Elon Musk is doing, taking your information that you don't want him to have, going into agencies like the EPA and cutting clean air and clean water programs, and going after programs that affect individual lives of working families across America. These are all things that are happening that they want to distract you from. So it's important for us to focus. Healthcare, they're about to take away your Department of Education. Could be 10% of all the funding for education, and especially funding for special education, which all of our districts need across America. So we're facing a real challenge. Red alert, everybody. It is time to wake up, get out, do something. Thank you.